This is the Dr. A Explains It All podcast, a podcast about cosmetic procedures, skincare, dermatology, and everything in between. I'm board-certified dermatologist Dr. Arash Akavan. Let's get started. But first, a quick disclaimer.
Medical disclaimer. The information provided on this podcast is for general information and educational purposes only. It is not intended as medical advice, diagnosis, or treatment, and should not be relied upon as such. Listening to this podcast does not establish a physician-patient relationship between you and the host or any contributors. If you have specific medical concerns or questions, we encourage you consult directly with a licensed healthcare provider or physician in your area. The views expressed in this podcast are solely those of the individuals and do not necessarily represent the views of any affiliated institutions or organizations. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment. Never disregard professional medical advice or delay seeking it because of something you have heard on this podcast.
Hi, for today's episode, I'm flying solo. We're essentially sticking to one topic today, so I thought for the purposes of efficiency and getting the information to you in the most simple way, I would just go alone. And the topic for today is something that keeps coming up, and it's been a new thing where a lot of patients who are calling to make appointments at our office, new patients, over the last year and a half have been calling and asking about getting their filler dissolved. And a lot of our patients that have been calling have also been asking what we can do that's like a filler, but not quite a filler, some of them with sort of wrong ideas about what we could do. So that's been an interesting thing. And I think a lot of it's social media driven. We've been seeing lots of people sort of talking about getting their filler dissolved on social media influencers on Instagram and TikTok. And so just kind of thinking about why are we getting this question? Are fillers really bad? Should everybody be getting their filler dissolved? Basically, some people are complaining the filler is making them look puffy. Some people are complaining that the filler has migrated and it's not the way it used to look 6 months ago or 3 months ago or 2 years ago. And both of these are reasons why people, and then some people have just been coming in and we're meeting them and they say they just want to dissolve their filler, and we ask why, and they say they don't know. They just feel like filler should be dissolved now. And so what are the bad aspects of facial filler that people are sort of upset about? Why is this a thing over the last year and a half? Why is it getting traction on social media? And I think there's three reasons. One of it is the fillers themselves have changed. So there's a few different competing filler companies in the United States and a few everywhere around the world. And they're competing against each other, and they need to come up with reasons why you should buy brand X and not brand Z, or check out the new subtype of filler brand Z just put out, and then they put out another one 6 months, another one a year later. And one of the big things is they want them to last a very long time, and then the other big thing is they want them to accomplish a lot with just a syringe. So one syringe or two syringes transforms this person's lips or their under eyes or their jawline or their cheekbones. And one way that they can accomplish a lot with filler is to have, so when I'm talking about fillers right now, I'm talking about hyaluronic acid fillers. That's the majority of fillers out there. There's other ones too. So the main hyaluronic acid filler brands in the US are Juvederm, RHA, Restylane, and they each have subtypes. And there's other ones, Belotero. And then the non-HA, non-hyaluronic acid fillers, Radius and Sculptra are the two main ones. And so right now I'm talking about hyaluronic acid fillers. Those are the only ones that you can dissolve. So that's the trend of dissolving those fillers. And one thing about hyaluronic acid that you may know from your serums and moisturizers and things like that is that it's known for its ability to attract water. It loves water. It absorbs water. And these newer fillers can absorb a lot of water. And that sounds great. But when you kind of think about it a little bit more, is that makes the results very variable. So some days your body retains more water than it does on other days. So is your filler going to swell in those days? It could. So that one syringe of filler, which is 1/5 of a teaspoon, maybe in your cheek has actually swollen on certain days to 5 syringes of filler, volume 5 ml, 1 teaspoon, or maybe 3. Maybe one cheekbone 3, one cheekbone 5. So that's one thing. And you wouldn't notice that if you were injecting 1 syringe of filler or 2 syringes of filler. But if you're injecting 10 syringes of filler, and 10 has become the equivalent of 30 syringes worth of volume, then that could make you look puffy, and that could be a bad thing. And another thing is that these filler companies are sort of competing on is how long they last, the longevity of the filler. And one way they can make them last longer is by getting them cross-linked. That means the hyaluronic acid molecules are really bound to each other. So they stick around longer, which again sounds great, but life happens, and that filler that you put under your eyes, maybe you slept on it for 4 nights in a row, maybe you rub your eyes a lot, maybe you swim for exercise and you wear goggles for hours a week on it. That can't be good. This is a gel under your skin, and it's under continuous pressure. Chances are it could move a little bit if it's sticking around for a really long time. And when I was training, 2 decades ago, that wasn't an issue because the fillers would last like 5-6 months. So they didn't have a chance to move anywhere. They'd be gone. So we wouldn't see migration. But now that they stick around, they migrate. So, that's 2 of the bad things that people complain about. And the fillers themselves have some characteristic changes that have occurred over the last couple of decades that make these things more likely. Another thing is the people that are injecting them. There's just too many people injecting filler now. But I mean providers. Again, when I graduated 2 decades ago, it was after residency at Mount Sinai here in New York City. We all of us residents had something called cosmetic clinic. It met twice a week. We would bring in our own patients there. They knew that we were going to be the ones injecting them. They were getting a discounted rate because we were training for the years that we were there in our residency. And we were training with the most accomplished cosmetic dermatologists in New York City. And it wasn't just hands-on training. It was also didactic, lectures and books and journals and tests, exams, correction of technique on people, seeing the patients back month after month at these clinics and seeing our results. And that was with fillers, it was with Botox, it was with lasers, it was with liposuction, it was with hair transplants. And that was part of our training. It was part of the plastic surgeon's training. And we were the only ones when I got out of residency that were doing these procedures. And then you start to see some physicians that weren't trained doing it. And then you started seeing nurses and PAs and estheticians and not to knock anybody, but there's a difference between that sort of training and training that you get on a job or at a certification course, and then you call yourself a certified injector. I'm not sure what that means. So the more people you have with less training injecting, I think it makes sense that you will see some results that are less than ideal. Leave it at that. And then the other thing is, the third thing I think that's sort of driving bad cosmetic results with injectables, with fillers in particular, is social media. So everybody trying to compete for clicks. How do you do that with injectables? By having amazing before and after results. You really should not have amazing before and after results with filler. They should be subtle. They should be hard to see. If they're amazing in a 2-dimensional picture, you probably put a lot of filler in. If you're saying you gave somebody a lift, or if people are saying, wow, that person looks like they had a lift, you probably put a lot of filler in. you probably put it in with an exaggerated sort of projection, weird injection techniques to get that result. And that's not going to look good in real life. It may look good in a 2-dimensional picture where they're looking straight at the camera. But the second that person's talking, interacting, bending their head down or up, or eating, it's going to look weird to everybody else. And that gives you weird contours and puffiness and lack of lines in the proper places. And a facelift should give you facelift results. And there are non-surgical things that can give you results that approach a facelift. When you combine things, a little bit of judicious filler, a little bit of this, a little bit of that, and we can get into those alternatives to fillers. But filler on its own giving you a facelift, probably bad news. So what would be good filler results? Because I love filler. I love doing filler, and I think we have great results with filler. I'm biased, but go to a trained person. Go to a board-certified dermatologist or plastic surgeon if you can. Not saying every board-certified dermatologist is better than every certified injector. Just chances are, but again, I'm biased, but chances are the person with years of rigorous training probably is more trained to do that procedure. Don't try and do too much with filler. Know its limitations. It should be injected very sparingly. Should ideally be injected pretty deep, over bone in certain areas. Another big thing is combine it with other procedures. Don't try and do everything with filler. Combine a little bit of filler, a little bit of skin tightening, and other procedures that rejuvenate. So combination procedures are always going to look more natural. And if a lot of time has passed, don't be afraid to dissolve and redo it. If we've injected your lips and 2.5 years have gone by, it makes sense that maybe your right upper lip is a little fuller than your left upper lip. Maybe it's traveled a little bit this way or that way. You've kissed, you've chewed food, you've played your trombone. I don't know what you've done, but it's not going to stay right where we injected it for 2.5 years. Dissolve it. Take a break for a week or two. Do it again. That's the way to have ideal results. And then the question of alternatives. So my favorite one, it's actually a company I've worked with in the past, company BTL, which everybody mostly knows from Sculpt, but they have an amazing face rejuvenation device that I think is a great alternative to fillers called EMFACE. Combines two technologies, radio frequency and the real thing that is the important thing, HIFES. So radio frequency, not important. It heats the proper level of skin depth to the proper temperature to get collagen and elastin generation to help with fine lines and skin texture and skin firmness. And then the HIFES, which stands for high intensity focused electrical stimulation. There's lots of contractions of the key muscles in the face. So in the cheeks, mid-face, this muscle called the risorius, the zygomaticus major and minor. On the forehead, the frontalis. Down here, the digastric under the chin. And you're building muscle tone in these, which gives a lifting effect to the mid-face, to the jawline, to the forehead and brow area, to this under chin area. And the under chin does other things that don't really pertain to here to help with double chin, but that's a different technology. But yeah, the EMFACE is a really cool device. There's zero chance that you're going to have funny looking results because it's your own muscle going back in tone. So we don't have to worry about weird puffiness, unnatural results, migration, things like that. Looks great. And if you want more, you can add a little bit of filler to it. But people really do love the EMFACE on its own, but it can be combined. And like I said, that's the most important thing, I think, honestly, is combining procedures. So you could take the EMFACE, you could add a little under eye filler, a little lip filler, a little tweak here, tweak there, without doing too much, and everybody's going to look natural. And the other thing you can combine it with is skin tightening. So that could be accomplished with ultrasound, like All Therapy device, FDA cleared for lifting. Can treat the face, the neck, the décolleté, the brow. And it uses ultrasound to target deeper layers of collagen to get a sort of a profound tightening effect. And that can give you a really great lift. So I really love that. And I love that in combination actually with the EMFACE. And all three of these things we mentioned can be combined, the EMFACE, the ultrasound, and a little bit of judicious filler here or there. And then the last thing I was going to mention is, as an alternative to fillers, it's funny, but when I talk about alternative to fillers, I'm talking about alternative to hyaluronic acid fillers. There's this other type of filler called biosimulatory fillers. One of them I mentioned, Radius calcium hydroxyapatite. We take this and we dilute it with saline. And this technique, is well documented in medical literature. Lots of doctors doing it with great success. We've had great results on the face, neck, and body with it. We inject it, and what we're injecting, most of the volume is just saline. It's water, salt water. And that water makes you puffy at the time of injection. A couple hours later, it's been absorbed in. And what's left is this fine sort of mesh of this Radius material that was suspended in water, this calcium hydroxyapatite, and your body forms collagen and elastin around it over the course of months. And you get this really nice sort of smoothing of skin, tightening of skin without volume. And it doesn't have water affinity, so it's not going to puff, doesn't migrate, lasts a long time. Excuse me. So that's another sort of procedure that you can do where you wouldn't have to worry about some of the things we're worried about with hyaluronic acid fillers. And then facelifts. And again, that shouldn't be overdone either. We've been, unfortunately, that's been the opposite trend. People getting facelifts a little too early, in my opinion, before they need it. And that also can look very odd in real life. Looks great in before and after in a two-dimensional picture on social media, but we've been seeing some very weird results around New York City, unfortunately, with this sort of sudden increase in the number of facelifts that's been occurring since the pandemic. So everything has its place. Things should be done in conjunction. That's sort of the lesson from today's podcast, I think. And filler still has its place as well. Just do little amounts, do it slowly, don't do too much. Know its limitations, combine it with other procedures, and you'll be happy with your results. Check out procedures like EMFACE. That can be a good substitute for it if you really don't want to do it, or combine the two. But yeah, we can have great results without surgery, with little to no downtime that you see quickly. But you just have to know the person who's treating you and yourself should be educated on the sort of benefits of these procedures and their limitations. As usual, if you have any questions about this episode or any other episodes or suggestions for future episodes, please reach out to us either by email or at drapodcast.com. Thanks. Talk to you soon.
Thank you so much for tuning in today. If you enjoyed this episode, please make sure to subscribe to Dr. A Explains It All on your favorite podcast platform. By subscribing, you'll never miss an episode, and you'll be the first to hear about our latest discussions on skincare, cosmetic procedures, and more. And if you found this content helpful, we'd love for you to leave a rating or review. It really helps us reach more listeners like you. To learn more about our podcast or to send us questions you would like answered on here, please visit our website at drapodcast.com. That's drapodcast.com. To see us as a patient at our New York clinic, visit us at dermatologyandlasergroup.com.